guys doing? Well, good morning. I'm really excited to be back in Polk County at the Florida Air Museum. I want to thank them for hosting us. I also want to thank Attorney General Ashley Moody for being here for this morning's announcement. We got a lot of other good folks who I will bring up in time. I do want to recognize we have the Mayor of Lakeland, Bill Mutz, and then we have all the commissioners, I think, from the city, or many of them have come for this announcement, so we want to thank them very much for what they're doing. We've been very clear in the state of Florida that we want people to be able to work and provide for their families. That's something that's very, very important. We've been able to do a lot of good things with the economy, given all the headwinds we're seeing nationally. You just saw the GDP number come out, anemic, far below what it was supposed to be. September jobs, 194,000 nationwide. Florida, in September, we had 84,500 jobs created in Florida. So we are, and then clearly businesses are doing so much better here than they are at almost any other place of the country. And so we're happy with that, and we want to continue to offer opportunities for people. And we've just made very clear, as you now are in an era where there are these heavy-handed mandates that are being hung over people's heads that threaten to deprive them of the ability to earn a living, that in the state of Florida, you have a right to earn a living, and it should not be denied to you based on these shots. And so we want to protect people who are working now in the state of Florida. These people have been working the whole doggone time, and then now all of a sudden they're going to get kicked to the curb. Give me a break. And then we have all these people who work for police and fire. You have some of these local jurisdictions that are trying to penalize some of those folks for that, and we just think that's wrong. Of course, there's a lot of federal mandates that are coming down. There's this OSHA rule that we're waiting for that applies to every business over a certain amount. There's a federal contractor rule, and then there's a CMS rule that's going to threaten to take away Medicare, Medicaid funding for healthcare institutions that don't force this on everybody. In Florida, we believe that these things, are choices based on individual circumstances. There are physicians that will recommend one course of action or another based on your health history. And of course, we know that many people, after now this has been going around for well over a year and a half, many people have recovered from COVID and also have strong immunity through prior infection. So you see that, and that's really what it should be. We also cannot have the federal government coming in exceeding their power. Some of the stuff that they're doing with the federal contract, they're really rewriting contracts, and they're transforming normal contracting into basically public health policy, and that's not anything Congress has ever authorized. And so that's a huge problem. Of course, the OSHA rule is a heavy-handed mandate, never authorized by Congress. They're using really obscure provisions to try to jam something down that will really have a significant impact all across the board. So we do have a responsibility to stand up for our authority here to govern ourselves and also make sure that this constitutional system of ours isn't out of whack. But there's also a practical issue with this, and I think you'll hear from some of the folks. If you do this, if you force this, there's going to be an attrition of people. People are going to lose their jobs. They're going to get fired. Others may just voluntarily walk away. That is going to throw a huge wrench into the operations of so many different aspects of the economy. And right now we're in a situation where, yes, we're happy in Florida. People are looking to us. We've done a lot better. But the United States as a whole ain't exactly lighting the world on fire when it comes to the economy right now. So why would you want to be able to do that? Do you think this is going to help the supply chain problems that we see? Do you think it's going to help lower gas prices? Is it going to help all these problems that we need to do? No, if anything, it will exacerbate. So practically, it just doesn't work. It's not something that is going to work. So last week we announced that Florida was going to be taking action, and so today we have additional announcements along those fronts to be able to protect people, to be able to protect their jobs, to protect their livelihoods, and quite frankly protect the whole economy so that it can continue to function. We are nearing the agreed upon dates with the legislature for the special session. I said it would happen in November. It is. I should have those dates hopefully today, and I'll be signing that proclamation either today or tomorrow. So we'll have the fixed dates. We'll know when we're coming in, and we know what we need to do. And the main course of business will be, make sure people are able to keep their jobs. We are not going to deny people the ability to earn a living based on their decisions about an injection. The second thing that we're doing here, and I had promised last week that we were, of course, needing to pursue legislation through a special session, which is what we're going to do. But I also made very clear, given the nature of some of these mandates and how they raise questions about the federal government overstepping its authority, we are also going to need to pursue litigation. And so I'm happy to say today that with thanks to the Attorney General Ashley Moody's leadership, today the state of Florida has filed another lawsuit against the Biden administration. This lawsuit challenges the Biden administration's order imposing a vaccine mandate on federal contractors, which was going to apply on December 8th. And so just because you're a business that has federal contracts, it's not right for the federal government to come in and rewrite those contracts and then try to shoehorn this in. And then if you don't comply, so you either have to fire people, or if you don't comply, they'll just cancel the contract entirely, even though this is something that you bid for and you won fair and square. That's not the way we think business should be done. We don't think that they have the authority to do that. But you are going to see, if we're not successful challenging this, you will absolutely see disruptions in the economy. I mean, just think of all the airline workers that are balking at this. I mean, we've seen different issues in different airlines, and I know that there's very many more. So this lawsuit is filed in the Middle District of Florida, over in the Tampa division. And we are going to seek a preliminary injunction so that this mandate isn't allowed to be imposed at the expense of the jobs of Floridians. We've got a very big footprint in Florida of companies that do contracting work for the federal government. We've got a lot of them over on the Space Coast of Florida. Of course, we have defense contractors. We have a bunch. And there's a lot of folks that'll be in the crosshairs on this. I think there'll be a lot of folks nationally, but Florida, we've got to be one of the top states in terms of who would be most affected by this. We don't want people to lose their jobs, and we obviously want to keep business going. We want people to be able want the economy to be able to continue function. So we think we know that it exceeds the administration's authority under the current law and Constitution, and I think we're going to be successful in this regard. This is the OSHA rule. That one hasn't even come out. It still hasn't not come out yet after all these weeks. And I wonder whether it's not come out because it's got a lot of problems. I mean, there's not going to be, I think, a very clear path for that to go forward. But this federal contractor lawsuit is not. The contractor rule has not gotten as much play as the OSHA, and these are distinct things. Contractor, I think, has a more limited application in terms of the number of employees it'll affect, but I think the bite is probably even more because you're really putting these businesses in an impossible situation where they would potentially lose a lot of their contracts or a lot of their money that is able to sustain them. We are, though, continuing to monitor what is happening with the OSHA rule. We will continue to do that. We're also monitoring what is happening with the CMS rule and how that would affect the healthcare system. I mean, just think about it. We've heard for months and months and months how hard it is to get enough healthcare personnel, how nurses are in short supply. Some of these nurses that are contracted out, they'll travel around the country. Huge money in that. It's very expensive to hire those folks because the demand is so high and the supply is low. And so to impose this mandate on that industry, if you even have a small number who end up, a small number of attrition, that is going to be huge. That is going to be very difficult for a lot of these institutions to be able to function. But again, they're going to be put in a rock and a hard place because they're going to have their funding through most of their patients that they serve potentially limited. We don't think that that's constitutional, but nevertheless, that's the stakes that we're dealing with. So here we are. We said we'd take action, and we are. This lawsuit has been filed. We think that we can hopefully get a preliminary injunction and be able to protect people's jobs from this mandate coming in and kicking a lot of good people out of work. And I want to thank the Attorney General for her work on this. I'm going to have her come up and say a few things, but I will be signing the proclamation for the special session. I said it would happen in November. It is going to happen in November. We think this is a relatively simple proposition. You obviously got to do some legislative legwork, but at the end of the day, people should be able to work, and we want to make sure people are able to work and people are able to provide for their families, and so that's what we'll be seeking during that session. So, okay, Attorney General Moody, she's been busy over the last 10 months, and it's just the way it goes. So come on up.
Well, thank you so much for being here with us today for this important announcement. Governor DeSantis and I have been clear. Never did we dream that in this administration we would be having to repeatedly push back on unlawful actions coming out of Washington, incompetent, reckless leadership coming out of Washington. But we're here. And we said when these vaccine mandates were announced that we would take legal action and push back. And I am proud to say today we are fulfilling that promise, and we have filed action in the Middle District of Florida challenging Joe Biden, NASA, OMB, GSA, and Bill Nelson for mandating that anyone with a federal contract require vaccination of all that work for them. In June, Joe Biden made clear that mandating vaccines, and I'm going to quote, is not the role of federal government. It's true, it's not the role of federal government. They have absolutely no authority to require vaccines of the majority of the U.S. population, none whatsoever. But neither his administration's own acknowledgement that wasn't within the purview of federal government, nor his statement that he would never do it, stopped him when his, and I'm going to quote, his patience wore thin and he became angry at those that weren't getting vaccinated. Only then did he announce he was going to use the federal government, overstep his bounds as president, blur the separation of powers, and demand that the majority of American workers become vaccinated. It is a complete and gross overreach of the federal government into the personal autonomy of American workers. His own press secretary said, well, there's really not precedent for this. Right, there's no precedent for this because it is unlawful. The framers, when they set up this delicate balance of power in our country, the separation of powers which has allowed this country to continue successfully, they didn't ever envision they would have a president that said, we'll do a crafty, unlawful workaround the strict separation of powers. Workaround their words. And so Governor DeSantis, I'm so proud of our governor here in Florida for repeatedly standing up to this administration and reminding them that this is not a dictatorship. President Biden or his handlers don't have the ability to control everything in this country. We, the states, have rights, and our citizens have rights and freedoms. And it disheartened me when I saw this president on national television laugh about freedom. The President of the United States of America laughed about freedom. Freedom is solemn. It is what defines us as a country, as a free country. And Governor DeSantis and I will always stand up for that foundation of this amazing country we live in. This illegal rule tries to do through executive fiat and through agency unlawful action what they have no authority to do. And so today we have challenged in court this unlawful mandate. for requiring all federal contractors to require their workers and those that work with them to be vaccinated. You will hear how this is affecting families and people that rely on these federal contracts right here in Florida. Whether that's Space Florida, the Department of Education, our universities, Florida will feel the ramifications. Floridians will feel the effects of Joe Biden losing patience and getting angry. I'm proud to be standing here with this governor and with all these amazing Floridians that came here to support us in our legal actions. We will not back down, and whether it's this or any other unlawful overreach by this president or his administration, we will proudly stand up for Florida and its citizens. Thank you so much.
And I think Attorney General makes a good point about they were saying this would never be appropriate to be mandating just months ago. It's like sometimes you got to just in the moment look back and think, okay, we've gone from 15 days to slow the spread to 3 jabs to keep your job somehow. Are you kidding me? And so I think we realize that, yes, this is an overreach. Yes, it's going to take away an individual's decision to do what makes sense for them. It does violate the Constitution. It's going to hurt the economy. But also, this is not the end of it, okay? I think we know they always say, oh, well, we just need to do this. And then they go on to the next thing, and then the next thing, and the next thing. And so it's important for us to take a stand, not only for what's at stake here with the folks that could be affected, but also knowing that if you don't give resistance to this, you're going to continue to see other things, and they're going to absolutely do more. I know there was recent news, people were asking about school children with vaccine. In Florida, there will be no mandate on school children. That is a decision that parents can make. That is not a decision that the government is going to be allowed to force here in the state of Florida. That's the law we passed earlier this year anyways, but we'll make sure that that's something that everybody is abiding by. Okay, so we've got a number of people here. So we've got Robert Doyle, Director of the Division of Blind Services at the Florida Department of Education. He's seen blind and visually impaired Floridians impacted by this looming federal contractor mandate. The people Robert serves oftentimes work in federal buildings and have federal contracts. And so he's here to tell us how the blind and visually impaired he serves are negatively impacted by this mandate, which is, of course, the mandate we're challenging here today. Okay?
Hey, good morning. Good morning. Thank you, Governor, for giving us an opportunity to come before you today and talk about how this is impacting folks that we serve. Again, I'm Robert Doyle. I'm the Director of the Florida Division of Blind Services, and I've been serving in this job for 8 years now. I get the pleasure, and our team get the pleasure every day of working to ensure that people who are blind and visually impaired have the tools, the support, and opportunity to be successful. But as the Governor said, these federal mandates through the contractor relationship is creating a system that is forcing our vendors to either make a choice between providing for their families or being able to and keep their jobs, or taking a jab that may not meet their own personal needs, their health needs, their religious needs, or whatever it may be. And we don't agree and don't support that these mandates would be doing that to our consumers. I've never been as concerned about what's happening to our consumer base as I am today. And I want to be clear, this is not a conversation about a vaccine. This is a conversation about a federal overreach. This is a conversation about a mandate that disenfranchises people from their opportunity to pursue their goals and their American dream. I'm extremely troubled with the government's actions trying to interfere with those personal healthcare decisions of our citizens and the clients that we serve. One of the things that I've observed with these mandates, I've had an opportunity to talk to some of our blind consumers, talk to some of the people in the field, and one of the things that I know for sure is that this will impact them. Now, throughout the pandemic, our blind operators, through one period, lost 42% of their revenue in serving in some of these federal buildings. They're out there on the front lines. They're out there making sure that there's food services in all of our buildings, and they've lost a good amount of revenue. And yet and still, right now, they're forced to kind of make a choice between are we going to take a jab or are we going to be able to provide for our families? Our blind entrepreneurs have weathered the financial impact of declining sales. They've had spoiled goods, food services. They've had limited capital. They've had difficulty in their hiring and their retention and their access to their facilities. And even before the pandemic, our blind consumers have had to overcome the attitudinal barriers of being blind and having an opportunity to work in those public settings. They've had to overcome technological challenges and training challenges as well. And now the federal government is implementing another barrier with these mandates. And while our consumers have produced very valuable services to the people of Florida throughout this pandemic, their livelihoods are threatened. And not only is the federal government threatening their livelihoods, but they're also threatening their dignity. They're threatening their self-respect, and again, their self-direction to achieve their goals. What they're doing is wrong. It's just plain wrong. And I'm so grateful. I'm thankful. I thank God for you, Governor. I thank you for what you're doing. I thank you that you're standing up for the blind. I thank you that you're standing up for the bold. I thank you that you're standing up for all the folks who may be bashful and may not have a voice. I thank you that you're standing up on behalf of our consumers and all the folks of Florida. And I thank you for giving us the opportunity to share how this is impacting them today. Thank you, Governor.
Okay, we also have TJ McCormick from Sefner, who's visually impaired. He's licensed by the Division of Blind Service as a vending and food service operator, meaning as an entrepreneur, he operates to operate cafeteria programs in federal buildings in Tampa. This one right here, knew him from back in her days. So, and so the contractor mandate applies to him, and so now he faces the loss of his livelihood as a result of this. And so, you know, he's somebody that wants this vaccine available for people, but he thinks the across-the-board mandate is very problematic, and he's going to come up and share his story.
All right. Good morning, everybody. Thank you for allowing us to speak our minds and give some kind of feedback on this. As Mr. DeSantis said, I'm a Randolph-Shepard vendor for the state of Florida. The Randolph-Shepard Act was originally created at the end of the 1930s, partly in response to many soldiers in World War I that were wounded and lost their eyesight. It also provided other people with visual impairment a means to employment and to make money for their families. And to go against those soldiers that fought and bled for the freedoms for us to have this, to have a choice, is wrong. In my particular establishment, I have 2 micro-market facilities in the Sam Gibbons and the Timberlake Federal buildings in downtown Tampa, as well as 14 vending machines scattered across those 2 buildings and another one, the Tramwell building, which is the state probation office. Over the course of the last year, during the shutdowns, my sales on a good month have dropped from 15,000 down to barely making 5,000. I was one of the more affected vendors, but I still managed it. My mother and I have been working every day since this entire pandemic started. I flew out of Las Vegas a week before they shut the country down. I was very concerned that I may have had it. Since then, we've taken steps to ensure that all of my percentages are the same. I've scaled everything down. I've neglected paying myself so that I could ensure that I have products for all of my customers that I don't think as customers anymore. Over this last year, we've all grown so close. I think of them as my friends and family. And I don't like not being able to give them the things that they like and enjoy that makes their day that much better when they have to be in a building and so much of the other population is at home. All of the security personnel, they all have to be there. They don't have a choice. And now you're giving them something else that they don't have a choice on. It's not right. It shouldn't be that way. It's an overreach. And I personally have not gotten the vaccine, as I'm waiting for more data to come out. Once all that information comes out, I will be more happy to consider doing it. But again, more information needs to come out. We're doing great right now. I'm just now starting to see an increase in my sales as more population is coming into the building and purchasing my product. But I'm living with this looming date that has been pushed back so many times now and is set at December 8th. I don't know what's going to happen beyond that point. I don't want to lose my job. I don't want to stop providing for my mother and our family at the house. And I really don't want to disappoint all those people that I've come to know as friends over the last year and a half. They depend on me and I depend on them. Without them, I have nothing. Without me, they don't have coffee. And as every one of you knows, the state government runs on coffee. Without coffee, nothing happens. So, with this choice,
Good job.
I want to choose to work. Thank you
Good
all
job.
very much.
Yep, thank you. Good job. Well, thanks, TJ. And you said you don't know what's going to happen December 8th. Hopefully, December 8th will come and the rule will be enjoined, and so you can keep working and keep doing a good job. And I want to bring up another Floridian that has actually lost his employment due to mandates. John Freeland. So he, I think, had an exemption that he wanted to do, and it was rejected, and so he was terminated. So, John.
Thank you, ladies and gentlemen, for coming here. And Governor, thank you very much for setting this up and standing up for us. Ladies and gentlemen, I have a little bit different of a perspective as to what's going on. With me, I've been employed for over 14 years. And my employer, I absolutely loved working with this company. I was director of fitness, and I enjoyed each and every day going in, and as director, I made sure my employees enjoyed each and every day coming in. For about 20 years, it took me to get to this level, and for 14 years, I worked at the highest level, bringing the dedication to excellence that was expected of me and all the other employees. My situation is that, unfortunately, 2.5 weeks ago, I was terminated. Now, I do have a medical condition. Unfortunately, throughout my time, I've had head trauma, and that head trauma will bring about seizures. What sparks it is a fever. Last time I had a grand mal seizure was back in 2019. I had sparked a temperature of 102.5, and that was documented by Palm Beach County Fire Rescue, the hospital that I had to go to for emergency care, and my doctor. Now, my doctor is a neurologist who is specialized in seizures itself. He made sure that he did all the work, all the tests as to what could have caused this, and it was a fever due to the head trauma. With everything that we know of all 3 vaccines, one of the side effects is a high temperature or fever. So you can understand my position of being put into that situation of putting myself at risk due to the mandates that are being taken place. I have followed my employer's policies and procedures all throughout this time. I wore a mask. I was tested weekly for the PCR testing, and I even had my door closed just to drink a cup of coffee or to make a phone call. Even though I had this medical condition, which my employer knew about, I had put it in writing. And I explained to them the situation at hand. I gave them the paperwork from the fire rescue, from the hospital, so that there was no doubt that what was causing my seizures were these fevers. Unfortunately, my employer didn't see it the way I did. So I tried to bring it to a different lens for them to see. I had asked my employer, if you had a child, son, daughter, and you took him to the pediatrician, and that doctor said, I'm going to give your child a shot, but with that shot, there's going to be a risk that that child might have a grand mal seizure. As a parent, would you continue to still have that shot for your child? A lot of people, a lot of parents, me included, I would second guess whether that shot was worth it. I would sit there and have to look at every possible thing, risk versus benefit, and could that be more harm for my child? My employer didn't see that way. They were going into the new policies and procedures that every employee had to be vaccinated. I tried to push on even more so. I said, okay, what if that pediatrician said, you know what, your choice doesn't matter. I'm going to give that shot to your child anyways. I know the risk, but I'm going to do it anyways. Unfortunately, I'm standing here because I did make that choice. This is my reality. This isn't, some analogy. This is, my life. As I come here before you, I'm in a position where it's now difficult for me to get a job. I'm an honest person, and when I look for employment, whether as a director, whether as a personal trainer, I will let them know this is why I've been terminated, because I didn't get the vaccine because of my concerns for my own health. Either those potential hires will say, I'm sorry, we can't hire you because you haven't been vaccinated, or they're telling me that the employment is looking to sway towards what President Biden's illegal mandate is looking to do. Now, as we are currently talking about with the date December 8th, we are talking at the federal level. We are talking about government. But as we also know, Biden's trying to push this into the private sector. He's trying to make businesses that are medium or large dictate to those employees, get vaccinated or lose your job. And unfortunately, that's happened to me because my employer felt that the government was pushing it, and it went well beyond the president's capabilities and responsibilities. Mr. DeSantis, again, I appreciate you standing up, not just for me, not even just for these people here, but we're talking every U.S. citizen, whether they're unvaccinated or vaccinated, because the federal government, the current people in that position, are overstepping their bounds. They are choosing what they think we should all do without having our own personal choice. We are America. We are the land of the free, and that capability of making our own choices is being stripped away. So again, I appreciate you helping me on my personal level, and we should be the United States. We're not in a dictatorship. We are not North Korea. We're not Russia. So please help everybody stand up to where this is going to lead up to.
Thanks.
God bless America.
Also there's just an issue of, how evidence-based are these mandates? If you look at it, this is not providing sterilizing immunity. In other words, you have people who are fully vaccinated that get infected all the time. I mean, that's not like it's rare. And actually, if you look at Public Health England, they actually do really good data, unlike the CDC here. They have, they actually show above 30, age 30 and above, that you're seeing infections even at higher rates for whatever reason. And so if you understand that, then you still got to do mitigation. If you're worried about a vulnerable person or something, great, but you still got to do the mitigation, because clearly, this thing can spread, and you've seen huge spikes in places that have huge percentage vaccinated. And so that's just the reality, that you're mandating a vaccine that's not sterilizing, and so it's reducing maybe your personal severity, but clearly it is not stopping the infections. And so, okay, we have Olivia Gregg here. So she's representing her husband and father. They both work in the aerospace industry, and her father has had a bad reaction to, I believe, the flu shot, and then has underlying medical issues, and was advised against the vaccine. He's only 3 years away from retirement, and her husband is also has his job on the line. So Olivia, can you give your story?
Thank you for having me. Hi, my name is Olivia. I'm one of the founders of Mandates Won't Fly. My husband works for an aerospace company on the Space Coast. I'm a stay-at-home mom to 3 young kids. My husband has been a hard-working, faithful employee with this company for 10 years and has his master's degree. He works tirelessly to be the sole income for our family so I can care and raise for our kids. This mandate has created a lot of uncertainty for our family and our future. The possibility of my husband's job being gone in roughly 5 weeks is terrifying. His employer is allowing certain exemptions if you meet specific criteria, but we don't know if he'll be approved. Will that be the end of it? What other requirements will be placed on them? When does it stop, or how does it stop? We are living in constant fear, questioning our family's future every single day now. We have met with realtors, contemplated selling our home just to cut our now affordable mortgage down. We live life playing out multiple scenarios of what we would do if our family's income disappeared. My dad has also worked for an aerospace company for 39 years, 29 of them being at the current company he's with. He's a dedicated, hardworking employee. My dad is a little over 3 years from retirement. My mom has health issues and insurance is a necessity for them. My dad has a vaccine injury from a flu shot he got in 2016. Prior to that, it was something he never would have questioned. The COVID-19 vaccine is not a one-size-fits-all issue. It should be a personal choice, a personal decision, something that my husband, my dad, or anybody can discuss with their healthcare provider on whether it's safe or necessary for them. Many people who recovered from COVID have high antibodies. Why isn't that sufficient? It shouldn't be between a vaccine or a livelihood. According to veteransflorida.org, Florida is the second in the U.S. for the number of aerospace and aviation establishments. There are roughly 17,000 aerospace-related companies that employ 130 Floridians in our state. Brevard County is where you'll find the majority of these companies. We are home to 1/3 of the aerospace employees. To say our economy will be hit hard by this is an understatement. It would be devastating. Not just to my family, but thousands like us. 2 weeks ago, I was just a mom. Now I'm a mom who's forced to take a stand. A mom who, along with 7 other women, have created an organization that helps us unite aerospace employees all over the United States. One of Mandates Won't Fly's mission is to help aerospace employees to not feel alone in this battle. If we don't take a stance now, stop this now, how far will it go? In one day, my husband and dad went from essential workers to expendable workers. Thank you.
Okay, so now we have Hy Hetherington. He's the CEO of HLP Integration. It's based in DC, but they have a big facility here in Polk County, and due to the federal contractor mandate and most of his employees are veterans, he may have to lay off between 200 and 400 employees. And so these are people, most of whom who've served our country, and so he's going to talk about the impact that will have.
Good morning. As Governor DeSantis said, I'm Hy Hetherington. I'm the CEO of HLP Integration. In 2019, I received a request of how are we going to better adjudicate and make more efficient and cost-effective how veterans get their health care claims. And having been in that field for a long time in information management, I looked at it and I said, we can fix this. We can bring better benefits to our veterans. And I am based in Washington, D.C., and we started looking throughout the country of where are we going to find the facility and the labor resources and community that we need to be able to support veterans in their health care claims. And we ultimately decided on Lakeland. We decided on Lakeland because we had a facility here that could support it. We also decided on Lakeland because we had an incredible community that was really passionate about the mission and what we were trying to accomplish in better serving the veterans that were willing to fight and die for all of us. So all those people started right at the beginning of the pandemic. And so as we're continuing to scale and grow our business, we started in January of 20, and then the pandemic hit, and they've worked tirelessly throughout the entire pandemic. We have continued to increase efficiencies. We've applied technology. We're using advanced analytics and AI to better deal with how claims are being processed for our veterans. And now we're in a situation where we have to understand how many of those employees that have been with us throughout this entire process are potentially not going to have jobs on December 8th. And not only are they not going to have jobs on December 8th, potentially, but in addition to that, how are we going to get more people in order to do this incredibly rewarding and altruistic work on my part, but an incredible mission that is so important to so many people, not only in this community, but throughout our country and throughout the world. And so these mandates are putting a lot of flux in play, and they're creating ideas that we're not sure what's going to happen. And so everybody's in flux, and this is going to affect a large percentage of the people that we have here in Lakeland. And so to humanize what we're talking about today, these people care about the mission. They are sitting with us and working with us because they care about serving their fellow veterans. And now we're putting them in a position where we can't tell them that you're going to still have a job doing that incredibly important work post a certain period. That's a really scary place for them. It's a really scary place for their families. And as an employer who is incredibly passionate about our veterans, I'm equally as passionate about my employees. And I have to ensure throughout this that I take care of both. And so thank you for letting me talk to you.
So we're excited to be standing up here with I think a really necessary lawsuit. I think we had a great chance of success and hopefully provide a lot of relief to thousands and thousands of Floridians who find their livelihoods in jeopardy due to federal mandates. So we're going to continue working on that. There will likely be more litigation ahead in other areas. And of course, we are going to take legislative action to provide protections for Floridians during a special session. So today is just one more step, but we're going to do more. We want to make sure we're protecting people's jobs, protecting people's livelihoods. Tossing people aside is just not something that we can tolerate here in the state of Florida. So we got to do everything we can to support folks and to protect their ability to work and thrive in our state. Okay, I'll take a couple questions. Yes, ma'am. So first of all, he actually explained, he offered numerous accommodations and it was more, I think, about an issue. There's pictures very close with no mask in other instances. I mean, I don't see people talking about that. So I think this was more, they're trying to politicize this, and I think not. I think he offered a lot of accommodations, and I think that that's something that is appropriate to do to offer accommodations. But I'd also say, Joe Ladapo, he's already made a huge impact. One of the first things he did was get rid of the rule that had been recommended by CDC that was quarantining all these healthy school children. So they would literally say, if you're in a classroom or you pass someone in a hallway who's positive, you got to go and wait for 2 weeks, even if you have no symptoms. And we know over 95% of the kids that have been quarantined never actually got COVID. And so it was terribly disruptive for families. Parents would get a call 6 o'clock the day before school saying, Jane and Johnny, they can't come in tomorrow because they're being quarantined. And the parents are like, what the heck is going on here? And so I told them, I said, this is disruptive. Where's the data to support it? And he said, there is no data to support it, but we know taking kids out of school for lengthy periods of time is disruptive for families and obviously hurts academic achievement, also hurts the ability to participate in activities. So that was done, I think, about 5 weeks ago, and some people were, the parents were with us, they understood, but you had the typical voices carping all this other stuff. The cases amongst school-age kids are down like 77% since we ditched the quarantine, the healthy quarantine rule. And so that's an example of being data-driven, understanding that there's more to public health than the avoidance of one respiratory virus, which fortunately has very little impact on young kids, and that you have to look at their ability to thrive and the ability to learn and all that other stuff. And so, that was clearly the right policy. We're much better off for it. And even having kids come back into school late August, change the quarantine policy the third week of September, we're now in a situation where we've seen huge declines. And, right now, Florida has the lowest COVID infection rate, case rate, and infection rate, or COVID estimate, in the country. And so that's, to me, what you want. You don't want somebody that's just going to genuflect to the narrative of the day or to listen to these TV doctors that have been wrong on everything from the very beginning. They said lockdowns would stop COVID. They lied. They said forced masking would end the pandemic in 2020. That was a lie. People said if 50% are vaccinated, you'll never have any surges. Well, we obviously have seen major surges, and we have way more than 50% vaccinated in a lot of different places. And so, you're either going to do right based on the actual data, or you're going to try to kind of kowtow. And I think the fact that he comes out and actually, does what the sound and data-based and evidence-based things are, that threatens people. That threatens folks who think they should control the narrative and think that they should be able to lead to even worse policies. And so I understand politically why people may not like that. It shouldn't be politics. None of this should have been from the very beginning. Unfortunately, it's been terribly politicized. And but I think that is a great example of the type of leadership that we want to see. And I can tell you, there are a heck of a lot of students and a heck of a lot of families throughout the state of Florida that are better off today having brought some sanity to this stuff than under the previous. Yeah. I have no, but there's no room for threats for anything. I mean, we have a crazy political time. There's people that do a lot of things that I disagree with. I think the way the people have tried to treat the Surgeon General, I think has been unfortunate, and I don't think it's been right. At the same time, I would never countenance any of that. I think that's wrong. Yes, sir. Because there's a lot of employment deadlines that are going to be happening soon. So if we waited until January, the middle of January, you unfortunately would have a lot of these deadlines happening. I mean, you even heard from one fella who already has been let go. And so I think time is of the essence on this. We didn't think it was going to come to this last legislative session. I don't even think we were discussing employer mandates because no one was talking about it. Biden said it shouldn't be mandated, that it's something that individuals have to make choices about. And then it just seems like it's just gone in this coercive direction. And so we have a responsibility. So I think if you look, most of the deadlines are going to be late November into the end of December. So by acting earlier, you're going to be able to provide protections. So there's actually providing protections. We don't want people losing their jobs or not being able to earn a living. But I also think just the fact that we're doing the special session, that's going to cause some of these folks to think, yeah, maybe that's not the right decision. Let me look at this. And so hopefully we can even slow the brakes. Now, we haven't had the OSHA rule yet. That's going to be challenged immediately. That OSHA rule's going down. That is not going to be able to stand. And so I'm confident of that. But, we've got to do what we got to do. So that'll be the focus, making sure people are treated well and making sure people are not marginalized or terminated on the basis of what. And the thing that really, really irks me, if you look and you act like that these mandates are somehow scientific based, I don't think anything that Biden has asked for or is demanding recognizes immunity conferred through prior infection. And we know that is robust protection for people. And so if you think about it, there's a lot of folks, particularly these first responders and others, who've been out and about. Many of them have recovered from COVID, and so they have protection. And then they're in a situation where they look at, okay, what's the benefit at this point? And maybe there is some, but then they weigh that and make a decision. So to not recognize that, I think is a huge, huge problem. And so that's something that absolutely should be something that is recognized, and it will be. But at the end of the day, if we act, I think if we act in November, which is what we're doing, I do think it's going to make a difference from a time perspective. And again, if you would have told me 6 months ago that these mandates were going to be coming down, I would have really worked hard in the last session to make sure. That wasn't something that was necessarily there. But it's interesting for the federal government to come and do this, because I just thought back to about 6 months ago. If you look at the vaccine uptake in this country, it went up very quickly once the supply increased, and it kept going up. And then in the middle of April, it fell off a cliff. And that date it fell off a cliff is the date that the federal government did the pause on the Johnson & Johnson vaccine. You had certain issues with certain demographics, but instead of saying that, they basically just paused it. That had a huge decline in the uptake from there, and really it's never recovered since then. And so for them, when Biden gets all upset and is doing that, I'm thinking to myself, well, wait a minute, Had you guys not done this or had handled that better, you wouldn't even be, perhaps even be in a situation, because you may have seen different levels of uptake. But that was something people said, whoa, well, and so I know our J&J, I know the demand plummeted here once that happened. So that's just an example about the way to do it. But at the end of the day, no coercion, just people should be able to make informed decisions. The more you try to browbeat people, the more you try to use the heavy hand of government, or even if it's just corporate power, it creates, it's bad for freedom, it's bad for the constitutional system, it's bad for the economy, but it then creates, I think, a lingering resentment. And then here's the thing, I'm really concerned about how this is going to impact other vaccines. For example, the normal vaccines that kids take, my kids take, most of your kids I'm sure do. I guarantee you are going to see a decline in that, because I think you're creating a lot of distrust. I think you're creating a lot of people who are looking at these people that have been on TV for a year and a half and they ain't told the truth. And that is going to have a lasting impact. And so to come here now and to be forcing this and to doing that without any regard of what that could do, I think into the future with as other issues come up, I think it's a huge mistake. But fortunately, Florida's fighting back. We have a good case in court. We're going to have a special session of the legislature, and when there's a need to stand up and protect folks when their jobs are on the line, we in the state of Florida, we're going to be there for you. We're going to get your back, and we're going to work like hell to make sure that your job's preserved. Thanks, everybody.